Why do ICU experiences cause PTSD? Imagine being in a place where everything is loud, bright, and out of your control. That's what many patients face in the intensive care unit. These experiences can be deeply traumatic and sometimes lead to post-traumatic stress disorder. When someone is critically ill, their life is at risk, and the treatments they receive are often invasive. Procedures like inserting breathing tubes, mechanical ventilation, or placing lines into veins and arteries are necessary to save lives. But these procedures can be frightening, especially when patients are sedated but still aware of what's happening around them. Feeling helpless and unable to communicate adds to the fear. Many ICU patients experience delirium, which is a sudden confusion or change in consciousness. Delirium can cause hallucinations or nightmares, making patients see or remember things that didn't happen or are distorted versions of reality. These false memories can be just as distressing as real trauma and may stick with the person long after they leave the hospital. The environment itself is also stressful. Constant noise from machines, bright lights, and frequent interruptions disturb sleep and increase disorientation. Patients often feel isolated from loved ones because of visitation restrictions or physical barriers, which can heighten feelings of loneliness and fear. All these factors, life-threatening illness, invasive procedures, loss of control, delirium, and a stressful environment, combine to create a traumatic experience. After leaving the ICU, many survivors develop symptoms of PTSD. They might have intrusive thoughts or memories about their stay, experience nightmares or flashbacks, feel hypervigilant or easily startled, and try to avoid anything that reminds them of the ICU. These symptoms can last 4 months or even years, affecting their daily lives and emotional well-being. Certain factors can increase the risk of developing PTSD after an ICU stay. The severity and length of the illness, the presence of delirium, and pre-existing mental health conditions all play a role. But even those without prior mental health issues can develop PTSD because of how intense and overwhelming the ICU experience can be. In essence, ICU experiences cause PTSD because they involve life-threatening situations, invasive procedures, loss of personal control, confusion, and a highly stressful environment. These elements can leave lasting psychological scars. If you or someone you know has gone through such an experience, it's important to seek support from healthcare professionals who can provide appropriate care and therapy. Remember, everyone's response to trauma is different, and help is available to heal both the body and mind.